guess everybody's getting up right now.
We'll wait till I guess there's some advisors. You want to come up front? Yes, we have some chairs.
Okay, good afternoon. My name is Urooj Zulfiqar, and I'll be presenting the biological and psychological effects of leukemia on children and their families. Before I begin, I'd like to go ahead and thank my faculty advisor, Dr. Sean Bediaco, Mr. James Sandoz, my INDS advisor, Carrie Sauter, and Ms. Patricia Leno for all the helpful insight that I've been receiving in the mail. And all my INDS faculty who are not here today, but they've helped me in the past 4 years. And as well as my my internship faculty, Jeanette and Molly, who are not with us. And today I have my parents in the room. My dad, he's making the video, and my mom, she's sitting all the way in the back. And of course my sister, she's the one talked about her BTR experience. So before we start anything, I want all of you guys in the room to close your eyes and picture the following scenario. You are in a park, a 2-year-old kid. As a 2-year-old kid, you're in a park, and you have so many things going on around you. You're happy, you're running around, you're thinking about it. Well, what do you see? You see yourself as a happy kid, you see mingling with other kids, and your family's around you. It's a really good scenario, right? Now we're going to shift a little bit to the second scenario. You're in a hospital bed. You can't get out of bed. All you see is nurses, doctors coming in, coming out, going out, taking IV samples, taking blood samples. You have IV up on your arm, and you're just in bed. And all you see is your family, parents, and friends coming in and hitting on you or trying to make you feel better. It's a totally different scenario, right? Well, my idea is that you are feeling lonely, you are feeling suppressed by just sitting in that bed. What would you do to give that life up to go back to the happy kid of a 2-year-old? Well, I developed the pediatric development of cancer. I looked into the main purpose, which was to the biopsychosocial factors involved in helping children better cope with leukemia cancer in order to live a healthy and a positive life. The idea is to establish an understanding of childhood leukemia cancer and to educate family and the patients on how to best cope with it mentally as well as physically in order to lead a positive and a better life. So usually the treatment itself is very, you can say very hard for children who are being treated for cancer. They have a hard time going through the treatment because treatment itself is worse than the disease. So what is cancer, you may ask? It is a biological disease that develops when abnormal cells in a part of body grow out of control. It is the leading cause of death in children, even though it's rare. It is found in children between the ages of 2 and 16. I focus into the more of an acute lymphoblastic leukemia and acute myelogenic leukemia, which are found in children below the ages of 15 years old. So what is ALL, or AML as I like to call? ALL and AML are a type of cancer that develops under the blood mainstream. And it spreads throughout your body, it infects the blood, and it spreads throughout your body, and that particular organ is the main affected, and it slows down the function of that particular organ or your brain cells. ALL is, in the United States, ALL is found among 2,400 students or children are diagnosed every year in the United States, and of those, 80% survive. And it affects between the ages of 2 and 7. And AML which is the most rare cancer. It's found under, there are 500 cases that are involved, and there is no way of telling how many survive from those 500 cases in the United States every year. So I developed an understanding of interdisciplinary studies. I use the disciplinary perspective of sociology, psychology, and biology to understand how children and their family best cope with cancer. Using the sociology perspective, I looked under the involvement of the community and the social group that can help through the following ways: either the cancer camp or the cancer treatment teams. And the cancer camp is the idea where family and patients are provided with knowledge and treatment to overcome it in a friendly environment. Basically, you're going to a camp, so you are among the same people who are diagnosed with cancer. You are with the family as well, and you learn how to deal with it through it's like a social group, but more of a fun activity-based social group. In this cancer treatment team, there are so many of them set up around the United States that we have no way of knowing how many are set up in each of the states. But the idea is to mainly guide the patients and their families on how cancer as itself is and how to go through it. The other aspect that I looked under was the psychological aspect, which focused on the mental level while diagnosed with cancer in the long-term and short-term procedure, and to look into the treatment as well. I looked under the resilience factor, which helped the family of patients recover through rapid mobilization, reorganization, social support of healthcare team, extended family, community, and the workplace, and they made changes in appraisal to make the situation more comprehensible, manageable, and meaningful. I also looked under the narrative stories of the families and the patients itself, and how they were treated in the long-term and short-term basis. And I incorporated that idea in my project to understand how I can help children in the future. I also looked into the stress factor and the gate control theory, stress factor and the humor, which they say laughter is the best medicine, and obviously it actually does work. And last but not least, I had biology as my last understanding on how cancer itself works. I looked under the genetics of the cancer, the symptoms and the signs, the effects if there were no treatment available, the differences between ALL and AML and their effects on children, and the biological treatment. So how exactly did I come up with all those all those disciplinary, how did I
incorporate
it? I looked under the peer-reviewed journals and the cancer-related books on narrative stories and camp stories. I also, using those ideas, I developed the psychological, some of the psychological theories. Two of the theories were the Erikson stages of psychosocial development and Paget's theory of cognitive development. I combined these two theories to examine the children's behavior towards cancer disease itself, the treatment, and the psychosocial factors of the cancer. And I developed into leading to that idea led me to the stress theory. Stress theory looked into the biopsychosocial factors that causes the stress, and that led to the gate control theory of pain, how children feel when they're in pain. I also used my internship as an experience to develop an idea on how children are at the Child Life Department of Johns Hopkins University Hospital. Using the integrative strategies of Miller and Boyd Mansilla, I used the building complex and multi-causal explanations and the bridging the explanation action gap. Using the idea of a the idea of building complex and multi-causal explanations, I defined the neurological problems of developing cancer and coping strategies, and defined through sociology aspect where the surrounding environment helps cope with it. And the explanation gap, I used the biological definition of cancer to maintain into the psychological development to develop an action-based solution towards it. I also used in extension and organization to help me organize this capstone project. In conclusion, why my project is unique, because it helps me understand the mental level of children, and because they're different from adults, it helps me understand how they are better able to cope with it and how their families will help them hence looking at a children diagnosed with cancer, it is best to understand it. So, thank you.
Questions?
Yes.
At your internship, did you encounter any social workers?
I worked at the internship, I didn't get the chance to explain it. At the internship, I worked with the 2-year-old in the the adolescent department, where I actually interact with children on one-to-one, face-to-face basis.
And they didn't have any social workers?
No, they didn't have the cancer with kids, but they had like every single children in that ward. So it didn't. I'm not allowed to find out what they're diagnosed with. So.
Okay. Cool.
Yeah.
At one point you said the treatment is worse than the disease. Can you explain that? At one point you said the treatment is worse than the disease in terms of cancer. Could you explain that?
The treatment, the cancer children, they have to go through several different treatments. If you are aware of the chemotherapy treatment, that itself is painful, because you lose more of your health, you lose more of your growth factor, it reduces, you lose your mental, like you're not getting out of your bed, especially for the first couple of months. You're going through several treatments that whole time. So the disease itself, yes, it's painful, but when it comes to the treatment, it's much more painful than the disease itself.
Could you explain a little more? You said you used the common ground strategy of extension. And could you share with us a little more about how you use that in your research or your analysis?
Okay. Yeah, I didn't get the chance to explain that. The idea of extension, I use it for treatment itself. Basically, the biological treatment, I focus into the biological treatment of cancer and extended that idea to the psychological treatment of cancer. So combining those two, it helped me understand that how children are able to live through it, not just biologically, not through the physical pain, but the mental pain itself as well. Okay, any other questions?
What are some of the techniques that they recommend for families at these camps to help with the agony of it, really?
Well, they kind of divided whenever they had just like the social group where they would divide the parents and the children separately, tell them how they have to work with their child and how the child will be behaving. So, and then they brought them together to it was like children were asked to go and interact with other children who were diagnosed with cancer, and then they learn from those kids as well that how to better cope with it. And then the parents, it's like a social group where their parents interacted as well, and then they brought them together to help them cope through it, to help them understand how the treatment works, how they are supposed to behave around their child, and what they should do and how they should teach them on having a positive environment around the house.
I suppose that can be ongoing too after
Yeah.
the camp. It's a
Yeah,
support group.
absolutely.
Okay, thank you very much. All right, Ryan Montgomery's been sitting here patiently all afternoon. Ryan.